told me, babe, someday these will be the good old days.
Hi, Miss Smith. It's me, your nurse, Marky. I'm just here to do some assessments and talk to you about the consults that are going to come talk to you. How are you feeling today?
Good.
Good. I'm glad to hear that. So I just want to get a little bit of background on when your symptoms started for the Parkinson's, which that would be the inability to move, the tremors in your hands where it's shaking. Do you know how long ago that started?
About a year ago.
Would you agree with that? Yeah. Okay. All right. So also, what kind of symptoms are you experiencing from this disease?
Just rigidity. It's hard for me to move. It's hard for me to walk. I have trouble walking.
Okay. Do you have any trouble swallowing?
Sometimes.
Okay, we did already do the speech language pathology consult to have them test your swallowing. So we'll have those results later on today. How are you feeling mentally about your new diagnosis?
Good.
Are you feeling okay?
Mm-hmm.
Okay. There's lots of different community resources that I'll come back. I'll print you out a sheet of all your community resources that you can talk to. There's support groups, there's family support groups. There's a lot of very good information out there and very good support groups for you. So I'll make sure and do that. So I'm going to assess your strength. So I'm going to have you push against my arms to try to lift up your legs. Okay. And then I'm going to have you push like a gas pedal on my hands and then pull up with your foot like this. Okay, great job. So the next thing I'm going to have you do, I'm going to sanitize my hands before I touch your hands though. Okay, I'm going to have you grab my fingers and squeeze. Okay, don't let me pull ya. Okay, don't let me push ya. All right, so that is it for my assessments today. And we're going to have some different consults come in and talk to you about what your future treatment options are and what we're going to have, the support system that we're going to have for you, okay?
Okay.
All right, do you guys have any questions?
No.
Nothing for you? You're the primary caregiver, correct?
Yep.
Okay, so I'll also print out some resources for you and make sure that you know what's going on and what to look for and how to help your mother through this, this diagnosis. So, all right, thank you guys.
All the love you won't forget, and all these reckless nights you'll regret.
You're doing great. Good job. How are you feeling? Are you dizzy? Hey, when you're walking, try to look straight ahead so that we don't concentrate on your feet or you trip.
Someday soon your whole life's gonna change. You'll miss the magic of these good old days.
I was thinking about the bands. I was thinking about the bands. We were underground, loaded merch.
Hi, this is Marky. I am Betty Smith's nurse. She's up in 502. I was just wondering what time you would be available to come in today to see the patient.
Patricia, this is Jenny. Oh yeah, sure, I can go see you 502 at 3 o'clock. Thanks.
Okay. Thank you. Dr. Coker, this is Marky from the 5th floor.
Oh, thank you. Well, hi, Marky. How's it going? Oh, you got patient Betty Smith? Well, I think I'll be able to get up there around 4 o'clock today. You said she's in room 502? All right. Thanks for the referral. Have a good day. Bye.
Beach, this is Jen. Hey, Marky, what's up? Yeah? Yeah, I can see Betty's book today. Let me check. No. Okay. 5:30 look good for you? Okay, bring in room 502, please. Thank you. Bye.
Hi, Betty. I'm the nutritionist going to be working with you today. Okay. So it's important that you have a balanced diet. You want to be really hydrated because you want to keep your blood pressure down and you want to have less symptoms of constipation. Fruits and vegetables are going to be necessary to keep you energized and hydrated. The medication that they're going to have you on is called levodopa or Sinemet, and it's a protein building block. So it will compete with absorption with other proteins. So you don't want to have a lot of proteins in your diet. So I'll talk to your caretaker about that too when she comes back. It'll actually reduce the effectiveness of levodopa if you actually eat more proteins. If you need a little snack before you have the medication, you can have a little like crackers or toast or oatmeal, just so your stomach is not upset. And it's just really important that you have maintain your hydration and keep your fiber intake up. Any questions?
12-passenger van in a small club in Minnesota, and the snow outside of First Ave. I just wanted my name and a star. Now look where
Hi, Mrs. Smith. How are you doing today?
Good, how are you?
Pretty good. I heard you newly were diagnosed with Parkinson's. Has anybody gone over the treatment options with you? Okay. Well, I am Dr. Coper from the neurology department. We have 3 different options that are available. The first option is the medication. It's levodopa carbidopa. Are you familiar with that? Have you heard anything about it yet? Okay. So what happens with Parkinson's disease is it disrupts the dopamine production in the body. So without the dopamine, your neurotransmitters start to have hyperactivity. So that's where you get the tremors and the shakiness and so on and so forth. The levodopa carbidopa will smooth those out. It'll try to balance the acetylcholine and the dopamine levels so that those shakes should disappear. The second treatment option is a deep brain stimulation. That is a DBS procedure. It's where we place an electrode in the brain into the midbrain portion, and it'll send a stimulation to try to interrupt those signals so that the hyperactivity actually slows down, and it'll smooth out those shakes and so on and so forth. Those things are done usually as a second step after we decide or we have determined whether or not the medication is working or not working. So first we try the medicine, and if the medicine is not able to work, and then we look into the surgical procedure, which is the DBS. And that's just something to think about during the future. We're definitely going to start the medication first. And the other thing is, with that electrical stimulation that there'll be a small incision in the brain, and then the electrode will go down, and then it'll have a wire that is tunneled down into the abdomen, and then there'll be a electrode. It's like a transmitter, it's kind of like a battery, but it'll send that pulse to make sure that the wavelengths in the brain and everything are.
Will that stop the tremors then?
Yeah, it'll slow the tremors down and whatnot. The other option, the third option, is an alternative medication. It is newly legalized. Have you guys heard about the medical marijuana? That's okay. So there's an oil called CBD. It's derived from marijuana, and it has been shown or proven that it does work effectively for Parkinson's disease. It is just an option, you know. If you do go with one of those alternative routes, we definitely want your primary care physician to know so that they're able to monitor. Okay?
Okay.
So, is there any questions that you might have? Okay, well, it's very nice meeting you.
Nice meeting you.
All right.
Still growing up. I would lay in my bed and dream about what I'd become. Couldn't wait to get older. Couldn't wait to be something.
Hello, I'm Jennifer C. Speech. How are you today?
Good hour.
Good. So I went over your results from your ovarian swallow, and they're a little bit abnormal. So what we're going to do is do some swallowing techniques. I have some exercises here that you can take home and that you can practice on. They're really easy and simple. The first one is called the Epicor swallow, and it's just a dry swallow that you're going to do 5 to 10 times a day, 3 days in a week, or 3 times a week. And all you do is you take like a ball of spit, and you're gonna swallow it, and you're gonna hold that really tight in your throat. Can you practice it right now?
Mm-hmm.
Okay. Like really tight. Hold it for 5 to 10 seconds, and then let it go. Okay. So what that does is that strengthens all our throat muscles, and that can help in your food go down more easily. Okay. So here's that. That's just a little reminder exercise how you do that. And then the second one is a super epigastric swallow. You don't want to do this with food at first, so just do this dry. And there's 3 steps to it. So what you're going to do is you're going to take a deep breath in, you're going to hold your breath, and then you're going to swallow. Okay, so you're going to get a little bit of spit in your mouth. And then you're going to cough right after you do that. And what that does is that helps clear anything out of your throat, strengthens your neck muscles also. Okay? So important thing after that is to cough to make sure that if there is any residue in your throat that you get that out, okay? Do you have any questions for me?
I do not.
We're just going to focus on those 2 right now because you don't really have severe or even moderate dysphagia, you just have kind of like a mild case. So I really think those 2 exercises would be beneficial for you right now. Okay?
Thank you.
You're welcome. And Nurse Markey will be in a couple minutes, okay?
Wishing I was still young. Those pills.
Hello, Mrs. Smith. It's your nurse, Marky. How you doing?
Good.
How are you feeling about all the consults that you had today? Good. I'm glad to hear that. Do you have any questions specifically about what you talked about? Okay. So, I got your orders that you can go home today, so you're being discharged. Are you going to go home with your daughter?
Yes.
Okay, so you're the primary caregiver? All right, wonderful. So I've got some information for you and the caregiver about the disease and different community supports that you have. So the first thing I want to talk about is, did the neurologist talk to you about your medication? The carbidopa levodopa? Do you understand how it works, that it increases dopamine?
Yes.
Okay, there's just a couple things I need to teach you about when you're taking that medication. The first of which is going to be, it potentially could discolor your urine or your sweat or any of your bodily fluids, so don't be alarmed if that occurs.
Okay.
You need to take that on like a set schedule, so that way you don't have, your symptoms don't come through and it's set, like you're constantly on the medication. Another thing that you need to do is wait 3 weeks before it'll start, it'll take 3 weeks for these symptoms to decrease. So just be patient with it and be patient with your disease. Make sure that you take your time and just be patient with yourself. Another thing about this medication is that you need to change positions slowly, so to prevent dizziness and some a drop in blood pressure. So just be mindful of your positioning and don't jerk around or move too fast. Another thing that you need to keep in mind while you're taking this medication is also if you have any changes in or the level of consciousness, if you're feeling if you have any like involuntary movements where you absolutely cannot control them, you need to let your primary care physician know. These things can be potentially dangerous, so it's just something you need to know about. So if she has that, or behavioral changes is actually what I meant. So behavioral changes or irregular movements, you need to report it to your primary care physician. So that's all that pertains to the medication. So, as for your consults, you know, you had everybody come in today. You said that you had some stress incontinence, which is where the muscles aren't keeping your urine in, so when you move around a little bit, it comes out. We're going to refer you to a urologist for that. Their office should call you within 1 to 2 weeks, so it's not going to be tomorrow, but it'll be pretty soon. If you don't hear from them from 2 weeks, I would call them and see if they got the referral in. The next thing that we need to talk about is physical therapy and occupational therapy. So physical therapy came in and consulted with you yesterday. They decided that you would benefit from having treatments at home. So they're going to call you after you're discharged and make those arrangements with you. Occupational therapy is going to come and they're just going to help you learn new skills to deal with your motor movements with your disease. So how to use different assistive devices, how to get dressed easier, and how to arrange your day around your disease. So that'll be something that'll be beneficial to you. So moving on to the final thing. I just want to give you some information. So first of all, the nutritionalist gave me this. This is just an overview of what you talked about the high protein diet.
Okay.
So that's that. Oh, and I forgot one thing for medication. It is very important that you take the carbidopa levodopa on an empty stomach, like 1 hour before meals, just to make sure that it absorbs completely into your system. If it does cause GI upset, meaning like nausea or anything like that, you can take it with like very small or low protein meals, okay?
Okay.
All right. So just wanted to get that out of the way because that was pretty important. So another thing, I have some community resources for you. So this is the Parkinson's Foundation of Michigan for Genesee County. This is all their contact information and where they meet and when they meet. So I just wanted to give this to you. There's support groups and different services that they offer that could potentially help you. And then also you can use it as a caregiver to help you find some support services for you, because you can have a difficult time with it potentially. I'm not saying that you're going to, but it is possible. So the last thing is I'm just going to give you a pamphlet just going over in general what is Parkinson's disease, what are the treatment options, what are the signs and symptoms. So this is for you if somebody else in your life wants to read about what's going on with your disease, you can give this to them and maybe they'll understand a little bit more.
Okay.
So there you go. And then as for before you get physical therapy and occupational therapy, it might be a good idea for you to get shoes with non-rubber soles, because the rubber soles will tend to catch on the floor, so it maybe make it a little bit easier for you to walk. Also in your home environment, make sure that you take all like rugs and make sure there's no like clutter on the floor or anything like that, just so you have an open area to walk in, and we want to prevent falls as much as possible. So with that being said, is there anything else you want to ask me? Or anything I can get for you before you leave? All right, thank you very much. Have a great day. Thank you.
All the love you won't forget, and all these reckless nights you won't regret. 'Cause someday soon your whole life's gonna change. You'll miss the magic of the good old days.
Wish I didn't think I had the answers. Wish I didn't drink all of that glass first.